Long COVID. Across the globe, researches and studies are being conducted to understand the pathophysiology of COVID-19. In India, more than 2.5 crores of population have been infected with COVID-19. Even though we have seen over 2.74 lakhs of death, more than 2.12 crore of patients have overcome this deadly disease and become COVID warriors. While we all celebrate their victory, our current focus is all to control the second wave. But more importantly, we also need to look into the long-term complications that are associated with this COVID-19 infection. Patients who recover from acute COVID infection continue to show certain symptoms beyond 4 weeks, and this is called long COVID. These symptoms could be the ones that they experienced during the acute phase, or it could be new symptoms which they did not experience during the initial admission. We have reports saying that some patients develop neurological complication like Guillain-Barré syndrome. We have reports to say that there are many patients being admitted with what is called the Blackfungus. We also see patients getting admitted with heart attacks or thrombus, blood clot either in the heart or in the brain and different areas of the body. So now it is thought that COVID-19 is not just infection of the lung, but it is a multi-organ disease. So patients who recover from COVID-19 acute infection, they need to be evaluated for long COVID problem. Based on various studies that has been conducted, it is shown that up to 10% of patients who recover from acute COVID infection will continue to have these symptoms or may develop new symptoms beyond 4 weeks, and these have been categorized under long COVID. CDC has categorized this long COVID into two. Those that continue symptoms beyond 4 weeks up to 12 weeks are categorized into subacute or ongoing COVID-19, and those that present with symptoms beyond 12 weeks are categorized into chronic or post-COVID syndrome. So then, what are the symptoms of this long COVID? Tiredness or fatigue, difficulty in thinking or concentrating called the brain fog, headache, loss of smell or taste, dizziness on standing, palpitation, chest pain, difficulty to breathe or shortness of breath, continuous cough, joint or muscle pain, depression, anxiety or post-traumatic stress disorder, continuous fever, and most of these symptoms get worse after physical or mental activities. The next most important symptom is anxiety or depression. The fear of being rejected by their own family, leave alone the society, the fear of getting back to their normal day-to-day activities. Most of these patients who recover from COVID-19 infection go through extreme anxiety or depression. Across the globe, long COVID clinics are being set up. Even in India, post-COVID clinics are being set up now. You need to be in constant touch with the doctor who treated you initially, and you need to follow the investigations they asked you to take. They might ask you to repeat the HRCT. They might ask you to do fresh blood tests. They might ask you to do pulmonary function tests. Please follow up with your doctor on a regular basis so that we can identify these symptoms at the earliest and treat them. How are these long COVID clinics organized? Most of these long COVID adopt a multidisciplinary approach where there are pulmonologists, cardiologists, kidney specialists, psychiatrists, physiotherapists, even hematologists. They all work together to identify these long COVID symptoms and treat them at the earliest. Today in India, all of you hear this word black fungus. So what is this black fungus? Initially, whenever their patients progress from moderate to severe infection, acute COVID infection, they are given steroids. These steroids reduce the body's immune power to work against the common organisms that are present in the environment. So this black fungus, mucormycosis, is normally present in the soil and it is present in the environment around us. Generally, our body has enough defense mechanism to fight against this fungus. But since our immunity is suppressed with a strong dose of steroids, which is actually given to treat someone with acute COVID infection, these fungus take an upper hand and their infection flare up within the body. So Now it is important that we look forward for any of these symptoms in patients who will recover from acute COVID and approach the concerned specialist at the earliest.